Hi, everyone. So, as Monica mentioned, I'm one of the 3 co-founders and the CEO at Onfido. And historically, over the last 8 years, our focus has just been to take people's offline identity online. And that is using a government ID and facial biometrics, mostly for financial services clients. Now, the relevance to health or immunity passports, we've started calling it health passports, but essentially it's the same thing. It's a presentable proof of your health status that returns a yes or no based on certain predefined organizations that are able to get access to that. The mass quarantine approach hasn't fully worked. It's worked in the short term, but it's not sustainable in the long term. And that naturally doesn't help with the economy. There ought to be, or could be, a government level initiative where there'd be 2 parts. The first is connecting your identity, connecting an app to a test result to suggest, yes, you've had the virus in the past and you don't seem to have it now, and you have an immunity for a period of, say, 6 months. And the second is to connect the app to the person's physical identity. And that's the role that we play. The question becomes whether we'd all be better off should the system exist. So when it comes to the science and the vaccines, we're running dozens of trials, as a species, trials and labs across the world. Some of these are actually going into production without late stage testing. Why is that happening? It's because the impact and the benefit of it would be so high. We're happy to forego the sunk cost. We're happy to potentially test some of these, even if they're not sort of highly effective, just to see if we can have a breakthrough. So part of the point is around, should we not perhaps try the same on the technology front? Given the shortfalls of contact tracing, given the shortfalls of some of the other reactive approaches, if health passports done appropriately were to effectively enable society to be able to get back to normal sooner, perhaps in a controlled way with very strict conditions, and in my view, it could only really work effectively if it's run by the government in a sort of clear, transparent, privacy-conscious way, then as you experiment, you get to know more.
Okay, well, yeah, so to step back, I do want to push back about this idea that somehow an immunity passport would be similar to a vaccine program. It's very different. To gain an immunity passport means that you have to have been lucky, and I'm going to say privileged enough to survive COVID-19. And I do think when we're talking about the potential for an immunity passport to create a 2-tiered system, or a new tier, let's say a new tier based on a biological line, which is incredibly concerning for me. And when we're talking about if we're creating a new kind of future, this to me is very much the return to the past. But if you can have 70% of a population being vaccinated, you can reach herd immunity to some extent, right? And that's something that if it's available, it's someone that can choose to have. Immunity passports are not going to be something by choice. It's something actually that's something that you're lucky enough to have survived this virus. My biggest concerns lie in the fact that immunity passports create the potential for new forms of discrimination and increased inequity. But I think what we have to step back on is just looking at who's weighing the risks and benefits, right? And what are the other possibilities? So yes, it might mean you can go to a hotel without a mask and like go to the gym and swim in the pool, but you could also go to a hotel and everyone wears a mask and you do some things differently, and you can allow for a situation where everyone can access that. And so I think we need to be a little bit more imaginative about what the possibilities are in a way that can allow everybody to be part of this new economy.
Fair. Insofar as, so the last point around alternatives, I mean, face masks, as everyone should be wearing these, right? Should have been wearing this from day one. Now, unfortunately, there's, as you say, we live in a really imperfect world, an incredibly unfair one. The 2-tier system already exists. As you know, probably better than I, this is way disproportionately affecting minorities and those from a poor background, as it is. So in an ideal state, this is a call for government intervention, government involvement. It's healthy to be skeptical. Everyone should be skeptical. And we should be skeptical of big government and big tech in equal proportion. And we find ourselves in suboptimal circumstances. And when you find yourself in a suboptimal place where there's this lack of trust, you kind of, you need to put in steps and measures to start thinking through conditions of under what circumstances can we account for and measure with strong regulation a scenario where some sort of health passport can, on balance, do more good than harm. So the first consideration or the risk is essentially restricting individual rights, especially privacy. And any health passport should really, or ought to really, only have a means of you sharing like a yes, no, and no more. So nothing about my medical history, nothing. It's just if I've been tested that morning and I don't have the virus right now, it's just a yes or no on that. And that's one way. So it's limiting the information that's shared to very little. Second is stigmatization and discrimination. This is probably the biggest risk, and what we should all be the most sort of thoughtful of. If you have like the bad scenario here with stigmatization is around you are a factory, well, there's a factory owner and there's 1,000 people that want to come there and work on like contractor basis or casual working or essentially without much protection. And the factory owner says, I only have space for 200 of you. So all of the ones that have this health passport, I only want you to work or give you the job and not the other 800. That is a big risk. And so again, you could mitigate with that with strong regulation. For instance, you could, as a centralized regulatory authority, you could stipulate that only the hospitals, care centers, and the airports are allowed to query or ask you to see a health result. And that's why it's important for it to be a government or centralized authority that runs it. So there shouldn't be any cost to this and it should be accessible to everyone. If you put in, if a health passport mechanism is able to get the economy working more effectively and getting productivity up again, then that might be able to, there may be a scenario where the funds could be used to create employment security and create healthcare security and all these provisions that in many countries are significantly lacking. So in summary, everyone should be skeptical. There is a path forward if there's collaboration, there are debates, and there's sort of fundamentally centralized regulatory authorities step in and run these schemes.
So from a scientific standpoint, like it is still far too early to be implementing policies based on COVID-19 immunity. Again, being clear that this is because we're talking about immunity gained by someone who's recovered from the illness, right? This could be a very different situation when we have a validated vaccine, that we know how it works, that we know how long it can make someone protected. Then it becomes a different conversation. But until then, it's a very bad idea scientifically. But my largest concern, and something that I'm really, really still worried about with an immunity passport, is it provides just one more platform for people to sort of be divided within society between sort of the haves and the have-nots, right? Based on what we're thinking like immunitycapital or immunoprivileged versus immunodeprived, right? So certain people are going to have more access to an immunity passport program than others based on, whether they can afford the antibody test, whether they can afford the smartphone that would have to prove their immunity through an application, whether they're lucky enough to survive COVID-19. So we know there's huge racial disparities on people's recovery from this virus. And again, a program like this means you have to survive the virus and not have long-term health impacts as well to be safely moving through society. So I have serious concerns about this playing out. Again, around racial lines, around socioeconomic lines, where again, there's going to be the white, the privileged, the wealthy that are going to have access and the rest are left out. So we have concerns around racial profiling, that again, this provides just one more reason that people could be disenfranchised by their communities. And then thirdly, I think something that's sort of a more long-term fear of mine, and I think we need to really be thinking about long-term, right? Because this pandemic has really, it's been incredibly challenging, of course, but it's also created an opportunity to sort of think about how can we do things differently? How can we make more just societies, ones where everybody can flourish and thrive, right? And what I think is that this establishes just another way to disenfranchise entire populations, and allow just, again, the same sorts of people to excel and succeed. And that's setting up sort of long-term, I think, things that could play out moving forward. It can start with the COVID-19 immunity. It could go on, then go on to have sort of biological passports that might show genetic sequencing, that might show other sort of health information. It turns into a situation where you have huge fears around surveillance and privacy. And so again, I think we really have to be careful about what decisions we make during this crisis and make sure that we're not setting up sort of a snowball effect that down the line, we are going to have deep regrets over this. And really, in my mind, we should be thinking about how do we create entirely new ways of being, not sort of perpetuating these sorts of divisions in society, which I think immunity passport could accomplish.